Mental illness, prevalent in the United States, is often neglected or even dismissed. As of 2016, the National Institute of Mental Illness states that nearly 1 in every 5 U.S. adults live with this disease. Being a patient advocate is my job, and it is imperative to be an advocate for every patient, whether their diagnosis be hypertension, diabetes, or schizophrenia. I want to be the voice for the misunderstood or overlooked population. Therefore, I'm going to address the current mental health services and addiction treatment policy as listed under the Affordable Care Act. This is also known as the ACA, and I'm going to compare it to the American Health Care Act, which is the AHCA for short. As a U.S. citizen, if you have a mental illness, you have several options for assistance. You could seek counseling, look into medication options, attend community organized meetings or groups. You may require inpatient treatment or even find a home in the local correctional facility. A lot of these circumstances or outcomes depend on your insurance coverage or the lack thereof. This coverage is mandated to some degree by the ACA, but the mandate dissolves with the American Health Care Act. This then forces the states to find a way through with the absence of the federal funding that the ACA has provided. The burden falls to the state to do this with less money. As we stand currently under the ACA policy, the Mental Health Parity and Addiction Equity Act, known as the MHPAEA, states all insurance plans must cover behavioral health treatment, such as counseling, mental and behavioral health inpatient services, and substance use disorder treatment. Also under the MHPAEA, you can't be denied coverage or charged more for coverage if you have a pre-existing condition, including mental health and or substance use conditions. Coverage for all of pre-existing conditions begins the day your coverage starts, and your insurance companies cannot put yearly or lifetime limits on your coverage. Lastly, limits such as financial, which would be deductibles or out-of-pocket limits, treatment, which is the number of days or the visits that have occurred, and care management, which would be the prior authorizations that are required for mental health and substance abuse services, cannot be any more restrictive than those placed for the medical or surgical benefits. Under the American Health Care Act, this coverage inequality may no longer exist. According to Medicaid.gov, Medicaid is the single largest payer for mental health services in the U.S. The AHCA, which passed the U.S. House of Representatives on May 4th of 17, will strip $800 billion from Medicaid over the next 10 years. 1 in 3 people covered by Medicaid expansion live with mental illness and or substance use condition. This AHCA bill will be ending this expansion, leaving these patients with very little options. The Congressional Budget Office estimates 24 million people will lose insurance for mental health care. This bill allows states to let health plans drop coverage of mental illness and substance use, and though they cannot deny coverage for pre-existing conditions, it will allow states to charge higher premiums for pre-existing conditions. When states are forced to cut enrollee benefits and or provider reimbursement, they're not going to start with states such as heart disease or cancer. Those illnesses are accepted and recognized in the public eye as serious medical conditions. Mental illness, however, is not viewed with the same empathy. This could be due to several reasons. Mental health is a disease state that can be analyzed not a disease state that can be used analyzing the objective data. Most mental health data is collectively subjective. This makes it a hard disease state to evaluate and assess. These doctors don't make groundbreaking discoveries because they lack the objective data needed for recognition. Pharmaceutical companies don't profit as much from this specialty. It's hard to prove your drugs are successful when there are no numbers or lab results to be analyzed to use as supporting evidence. And it's obvious from Forbes' database that the public does not support this disease state with quite the same appreciation as others. According to Forbes, just in 2017 alone, $670 million in private donations were raised for the American Heart Association, $780 million raised for American Cancer Society, and a whopping $1.37 billion donated to St. Jude Research Hospital. Somehow the stigma that surrounds mental health is just not quite the same. These patients are not your poster children for a cause worthy of your attention or donation. This is why I fear it'll be easy for the states to let mental illness be one of the first cuts made when depressing the Medicaid expansion. Ironically, President Trump has declared medical emergency to our country's current opioid crisis. This seems like an unfortunate time to cut Medicaid spending. So let me make this suggestion. Why not push for a huge lobbying effort, encouraging families to step out of the shadows and start a movement? What an opportune time for a hashtag. Lobbyists pushing legislators will not only shed light in the political world, but it will change the perception that there isn't a problem. This will also turn the heads of medical providers. If we can do a better job at education and screening, maybe we can cut down on the number of mental health crises. This will in turn limit the number of hospitalizations and hopefully cut down on the number of intakes the correctional facilities see as well. Though there are several aspects to the AHCA that I agree with, diminishing Medicaid expansion and support is not one of them. Will the good done by the cuts outweigh the good that would have been done by the 1 in 5 U.S. citizens affected by this decision? Now I'm calling on you to take action.